Artificial intelligence is rapidly transforming healthcare from the inside out, turning science fiction into daily reality. What once took days of laboratory testing can now be done in seconds by an algorithm. From diagnosing cancer earlier than ever to predicting heart attacks before symptoms appear, AI-powered tools are saving lives around the world. Yet, as technology gains access to our most personal data, our bodies, habits, and medical histories, it raises deep ethical questions about privacy, consent, and trust. The future of medicine may depend on how humanity balances these competing forces of progress and protection. At its best, AI acts as a digital physician's assistant, one that never sleeps. Machine learning systems analyze millions of medical records, images, and genetic sequences to find patterns invisible to human eyes. In radiology, AI can detect tumors in X-rays and MRIs with accuracy comparable to or even greater than trained specialists. In cardiology, it can identify early warning signs of heart disease, while in ophthalmology, it can detect diabetic retinopathy before patients lose vision. This ability to catch diseases early when they are most treatable represents one of the most profound breakthroughs in modern medicine. AI is also reshaping diagnostics and drug discovery. Traditional research can take years of trial and error, but AI can simulate outcomes, analyze vast chemical databases, and identify potential drug candidates in a fraction of the time. During the COVID-19 pandemic, AI played a critical role in tracking outbreaks, modeling infection rates, and even helping accelerate vaccine development. By processing massive datasets faster than any team of researchers could, AI enabled science to respond at the speed of crisis. In hospitals, AI-driven systems are improving workflow and reducing burnout among healthcare professionals. Automated transcription tools free doctors from paperwork. Predictive analytics help hospitals allocate resources efficiently, ensuring that critical care units are ready when emergencies strike. Chatbots and virtual health assistants are guiding patients through pre-diagnosis questionnaires, mental health check-ins, and even post-operative care. These tools extend medical expertise beyond clinic walls, making quality care more accessible than ever before. However, behind every life-saving algorithm lies a massive network of data, and that's where the tension begins. For AI to be effective, it must be trained on enormous amounts of personal medical information. Genetic profiles, clinical notes, lab results, and even wearable sensor data. Every heartbeat measured by a smartwatch, or every glucose level tracked by a fitness app adds to the data ocean that fuels AI's intelligence. But who owns that data? How is it stored, shared, and protected? These questions lie at the heart of one of the biggest ethical debates in modern healthcare. Data privacy is not just a technical concern, it is a human one. Patients often have no control over how their information is used once collected. Some healthcare systems share anonymized data with tech companies for research, but the risk of re-identification always exists. A breach in a medical database doesn't just expose financial details. It exposes genetic information, mental health records, and private life choices. The consequences could extend beyond embarrassment to discrimination, affecting employment, insurance, and even personal relationships. AI systems also reflect the biases of the data they learn from. If algorithms are trained primarily on data from certain populations, they may perform poorly for others. This can lead to misdiagnoses, unequal treatment, and systemic inequities, issues that are already present in healthcare but could be magnified by automation. Ensuring fairness requires deliberate diversity in training data and continuous monitoring of algorithmic outcomes to prevent digital discrimination. Governments and regulators are beginning to take notice. Laws such as the European Union's General Data Protection Regulation, GDPR, and various health privacy frameworks are setting standards for how medical data can be processed. Meanwhile, hospitals and research institutions are adopting encryption, anonymization, and consent-based data collection to protect patients. Yet technology evolves faster than legislation. As AI systems become more sophisticated, new loopholes and risks will continue to emerge. Despite these challenges, the promise of AI in healthcare is too significant to ignore. Predictive analytics could one day stop pandemics before they start. AI-guided robotic surgery could achieve levels of precision beyond human ability. Personalized medicine could tailor treatments to each individual's genetic code, extending life expectancy and improving quality of life across the globe. The ultimate goal is a future where AI empowers doctors, not replaces them, and patients remain at the center of their own care. The balance between innovation and privacy will define the next decade of healthcare. Society must choose to design systems that value transparency, ethics, and human dignity as much as efficiency and speed. Technology can analyze the body, but only humanity can protect the soul of medicine. In the end, artificial intelligence is neither hero nor villain. It is a tool. Whether it heals or harms depends on how it is used and who controls it. The future of healthcare lies not in rejecting AI, but in mastering it responsibly, ensuring that every byte of data leads to a healthier, more compassionate world.